Mila Kofman is an associate research professor at Georgetown University Health Policy Institute. She conducts a range of studies on the uninsured and underinsured problems focused on private market reforms, regulation, access, and affordability. Ms. Hoffman has testified on several occasions before the U.S. Senate, our House of Representatives, and state legislatures. She is recognized and cited as a national expert on insurance regulation, unauthorized insurance, and ERISA. She was a federal regulator at the U.S. Department of Labor from 1997 to 2001. Ms. Kofman holds a law degree from the Georgetown University Law Center and a BA degree in government and politics from the University of Maryland at College Park, summa cum laude. Welcome, Ms. Kofman.
Thank you very much, Mr. Chairman. I thank you and the committee for your leadership and willingness to examine how ERISA has been used to impede state-based health care reform initiatives. Although I believe we should address the health care crisis as a nation and develop a national solution to ensure that all Americans have the same basic rights and protections no matter where one lives or works, absent meaningful and comprehensive federal reforms, you should look for ways to make it easier for states to act. A law Congress enacted more than 3 decades ago, ERISA, has become a major obstacle to states. Unlike public policy discussions 3 decades ago when ERISA was passed, in 2007 we have 18,000 Americans who die preventable deaths because they're uninsured. The leading cause of personal bankruptcies in America is having an illness. We have millions without insurance and millions who are underinsured. 80% of the uninsured are in families with either one full-time or part-time worker. 1 in 4 people with group coverage and nearly half with individual health insurance spend 10% or more of their income on medical expenses. Health coverage is inaccessible for many, unaffordable for many more, and insecure for those who have it. While some states are trying to respond, ERISA, a 1974 law, is a major obstacle. Today, I will highlight for you 3 negative impacts that ERISA has had on state efforts. First, ERISA limits states' ability to reform state-regulated health insurance markets and makes it difficult to pay for coverage expansion programs. For example, state guarantee access and rating laws designed to make insurance more affordable for small businesses with sicker workers has been undermined by ERISA, which allows employers to self-insure. When small businesses with healthy workers self-insure, their claims are not pooled with others, and coverage is more expensive in state-regulated products as fewer healthy people help pay for the sicker ones. Another example is when states raise the age of dependent children, like in New Jersey, to the age of 30, to keep people covered longer in group coverage. That requirement does not apply to self-insured ERISA health plans. Financing coverage expansion has also been a problem. Some states have public-private partnerships, HIPPICs, alliances, purchasing pools for individuals and small businesses. While programs vary, none are free, and ERISA self-insured plans generally do not help pay for them. Second, ERISA limits state options when considering broad and comprehensive health care financing reforms beyond reforming the insurance markets. For example, some states have concluded that employers should help pay for medical coverage for their workers. One way is through fair share laws that establish minimum standards for how much employers contribute. These proposals would assess a penalty on employers that fall below the threshold, and those penalties would help pay for public health programs and clinics. To this end, Maryland passed a fair share law. The law was immediately challenged and was found preempted by ERISA. In Maryland, the law was a response to many workers of one large company using public insurance programs and clinics and draining public resources. Interestingly, the company in question increased its spending on health care for workers, but challenged the law anyway through one of their associations. Massachusetts last year passed broad reforms. One new requirement there is that employers with more than 10 employees provide health insurance or pay a fee. Already there are rumors that some of the lawyers who challenge the Maryland law are looking for businesses to represent in Massachusetts so they can go to federal court and use ERISA to challenge Massachusetts reforms. What's important here is that Maryland and Massachusetts laws were carefully crafted to avoid ERISA challenges and ERISA preemption. But as demonstrated in the Maryland case, your odds in Vegas are better than your odds in predicting how ERISA will be interpreted by federal courts. The third negative impact of ERISA is that it has a deterrent effect. The ERISA threat has stopped many states from considering or even debating certain reforms. Last year, there were 28 states with fair share bills. This year, 3 had those bills. There's also a practical resource problem. States need upfront money to implement new programs like the Massachusetts Connector. The ERISA preemption risk deters many from even trying. In conclusion, Mr. Chairman, this committee and the Congress have the power and opportunity to make it easier for states to achieve universal access to health care and coverage. As you examine the 74 law, you have many options, 3 of which include allowing federal regulators to give ERISA exemptions, clarifying that Massachusetts and Maryland type reforms are not preempted, or clarifying that certain types of state reforms beyond Massachusetts and Maryland are not preempted. There are, of course, pros and cons to any approach. Whatever you decide to do, however, the time to act is now. Many states will continue to explore what is and is not allowed under ERISA, but this means more litigation, which is not a good way to respond to the health care crisis or to reform our market. Thank you for your consideration. I look forward to assisting you as you look for ways to address the health care crisis in America. The health care crisis is really a silent disease on the middle class that's killing the middle class. And I hope that this is the year that Congress will act.